So, vitamin A. The vitamin A role in eyes. So, the vitamin A is derived from a plant source called as beta carotenoid. Beta carotenoid is taken through the diet. It gets absorbed in the small intestine, and when it is absorbed into the small intestine, the beta carotenoid is then converted into the retinol. Retinol is an active form of vitamin A. And after this conversion, the retinol is esterified, that is, combined with the fatty acids, it gets esterified and stored in the liver as retinal esters. And when needed, the mobilization occurs. The retinol is released from the liver and bind to a specific protein called as retinol binding protein for safe transport in the blood. The functions in the retina. The retinol reaches to the target cells, that is mainly the retina, especially rod cells, which is responsible for dim light or scotopic vision. In the retina, the retinol converts into the retinal, and retinal combines with a protein called as opsin to form rhodopsin. And rhodopsin is a light-sensitive pigment in the rod cells. When the light strikes the retina, the rhodopsin undergo photochemical changes. This leads to the signal sent to the brain, enabling for the vision in dim light. Retinal is oxidized in this process and cycle continues. Next, we are moving on to the recommended daily allowance of vitamin A. In infants, it is 300 to 400 micrograms. In children, it is 400 to 600 microgram, and in adolescents, it is 750 microgram. So, vitamin A deficiency. What are the manifestations of vitamin A deficiency? Mild vitamin A deficiency manifests with follicular hyperkeratosis of skin that consists of rough skin with the raised hyperkeratotic patches resembling the goosebumps. Defective dark adaptation is one of the early characteristic clinical feature of vitamin A deficiency, which often results in night blindness. The ocular epithelium becomes dry and causes xerophthalmia. Hyperkeratinized with the appearance of small foamy silvery lesions on the conjunctiva, that is called as white spot, is another manifestation of vitamin A deficiency. The more severe cases, it leads to hyperkeratinization of cornea with the appearance of corneal opacity, which can progress to the ulceration and infection, that is called as keratomalacia. The loss of mucosal integrity of the respiratory and gastrointestinal tract and impaired immunity predisposes the children to severe systemic infections, especially measles. Next, we are moving on to the treatment. So, treatment mainly consists of oral vitamin A doses less than 6 months of age, 50,000 international unit, and 6 months to 12 months, it is 1 lakh international unit, and more than 1 year, it is 2 lakh international unit. The same dose is repeated the next day and for 4 weeks later and after 4 weeks. So, clouding of cornea in a child, if it is seen with vitamin A deficiency, it is an emergency condition. Parenteral administration of vitamin A is required with a dosage of 50,000 to 1 lakh international unit. Keratomalacia. In the case of keratomalacia, what we need to do is that the local treatment with antibiotic drops plus ointments and padding of eye enhances healing. Moving on to the classification, primary sign, secondary sign. The primary sign X1A, that is conjunctival cirrhosis, X1B, that is white spot, X2 is corneal cirrhosis, X3A is corneal ulceration less than 1/3 of the cornea, and X3B is corneal ulceration more than 1/3 of the cornea. And XN stands for night blindness, XF is fundal changes, and also XS is corneal scarring. Moving on to the prevention. So, the dosage of 1 lakh international unit with the measles vaccine at the 9th month is included in the immunization schedule. And 2 lakh international unit along with the TPD booster at 15 to 18 months is included, and in endemic areas 3 more doses are administered at 24, 30 and 36 months. What do you mean by hypervitaminosis A and teratogenicity? Vitamin A toxicity occurs with the ingesting greater than 50,000 international units per day for several months. Adolescents, retinol or retinoic acid for the acne treatment also causes vitamin. Excessive retinol or retinoic acid for the acne treatment causes hypervitaminosis or vitaminosis of vitamin A. And there are acute manifestations and chronic manifestations. In acute manifestation, that is pseudotumor cerebri, that is, it includes vomiting, irritability, bulging of frontal, diplopia, and headache. In chronic manifestation, anorexia, dry skin, alopecia, painful joints, and hepatosplenomegaly. So, WHO recommends a vitamin A intake during pregnancy should not exceed 3,000 per day or 7,500 per every week. Vitamin A is teratogenic if taken in high doses in early gestation. Thank you.